Hello, my name is Demara Perry, and today I will be presenting my presentation on substance abuse in rural areas. So to begin with, rural areas have been defined in multiple attempts. The United States Census Bureau has defined rural areas by regional population density, the region's proximity to urban centers, and the overall population size of a particular region. Rural areas, also defined by the Federal Office of Management and Budget, is also known as a non-metropolitan statistical area, and it is a county that has a population less than 50,000 people. There have been other approaches used to measure the term rural, which include the Economic Research Services Rural Urban Continuum Code and the Urban Influence Code. Both approaches are sponsored by the United States Department of Agriculture and expands beyond the dichotomy of a location being either rural or urban. Rural social work practice has a long and captivating history, but it is filled with a vast number of complications, debates, and discussions. Rural social workers often have fewer resources to draw upon, creating a need to maintain a broad range of skills and abilities. Rural social workers also focus on identifying the needs of others through the process of help and mutual aid assistance that are available in the community. Micro, meso, and macro social work practice are all a part of rural social work. But being that this presentation centers on macro social work practice, social workers in rural areas working in this entity works directly with systems that supports individuals, families, groups, communities, and societies. In addition to community organizing, regional planning, advocacy, policy and political work, leadership, supervision, and administration are all examples of macro practice. So the issue of this presentation is substance abuse. Nearly everyone has one or more relatives or friends who are abusing alcohol or some other drug. In addition to, about 200 million people, or about 5% of the entire population of the world, has abused an illicit substance. For nearly thousands of years, substance abuse has been a problem for society, and substance use disorders as a whole remain the most prevalent mental health issue facing society today. Substance use disorders can take any number of forms, such as alcohol use disorders and nicotine use disorders, which are subsets of substance use disorders. Drug abuse, also referred to as a chemical substance abuse, is the regular or excessive use of drugs and results to the endangerment of relationships with other people, are detrimental to a person's health, or jeopardize society itself. Drugs that are being abused include narcotics, depressants, hallucinogens, and cannabis. Alcohol falls under the category of a depressant and is the most commonly used psychoactive chemical. Marijuana falls under the category of cannabis and is the most commonly abused illicit drugs. So the issue with substance abuse in rural areas is that many individuals in these smaller communities face more hardship in their journey to sobriety. Due to a lack of resources in rural areas, author Young et al. Observed that there are 14 specific barriers related to substance abuse recovery in rural areas. However, those 14 barriers were identified within four broad categories, which are substance-dependent rural residents, access to treatment services, their access to other professionals, their access to peer support groups, and access to confidentiality. Results indicated that substance dependence is more likely faced by residents of rural communities than urban residents. Due to a lack of mental health facilities, individuals recovering from a SUD, which is a substance use disorder, in rural environments have a greater chance at relapsing. Individuals in rural areas who may be receiving medication-assisted treatment, which is also known as MAT, may have to travel up to 30 miles or more to the nearest health treatment facility. In addition to, data from the National Service on Drug Use and Health indicate that non-medical prescription opioid use has increased dramatically in the last 20 years. Research found that rural drug users had significantly earlier ages of onset for use of oxycodone, hydrocodone, cocaine, and crack. Rural drug users also had significantly higher odds of lifetime and recent use of methadone, oxycontin, and oxycodone. Rural drug users had significantly higher odds of lifetime cocaine and crack use. Residents of non-metropolitan areas have experienced an increase from 6.3% to 7.3% in the prevalence of illicit drug use from 2008 to 2009. Another issue with substance abuse in rural areas includes residents commuting to inpatient or outpatient facilities or receiving health services within their community. However, research has found that telehealth has been growing within rural communities. Rural treatment programs face difficulties in recruiting and retaining qualified professionals and staff because of the economic climate. However, with telehealth, rurally located providers can receive enhanced training, a reduction in isolation, and increased opportunities for collaboration. In similarity, telehealth benefits the rural clients because there is reduced travel time and costs, reduced separation of families, and a reduced number of missed appointments. Literature says that telehealth can successfully be implemented for overcoming barriers to adequate services in rural and geographically isolated areas. So, a theoretical framework that relates to this issue is systems theory. Systems theory, or ecosystems theory, is a theory used to describe and analyze people and other living systems and their transactions. When assessing substance abuse in rural areas, social workers can use systems theory to assess their clients' person and environment interaction with the various systems around them. For example, these systems may include family, friends, work, and educational systems. System theory requires social workers to focus on the person and the environment. In addition to, system theory is a common structure approach to the helping process because it serves as a blueprint or an organizing guide for assessment and intervention at a multiple system level. Social workers will be able to see how their client systems impacts their substance abuse. A policy that relates to this issue of substance abuse comes from the Health Insurance Portability and Accountability Act, which is also known as HIPAA, with a focus on a distinctive and stricter section. This section is 42 CFR Part 2. The HIPAA policy protects clients who are in treatment facilities from getting their information exposed. This policy also gives a client a right of confidentiality. While in treatment, patients have the right to not disclose any information to anyone inside or outside of the treatment facility. However, if patients choose to do so, they must complete and fill out a consent and authorization form. The only excuse as to why a patient's information may become disclosed if it relates to someone's life being at harm. Initiated in 1996, HIPAA protects many patients who are seeking health and treatment services today. So there are several programs that have been implemented to treat individuals with a substance use disorder. One program, which is named Alcoholics Anonymous, is a widely known program with over 2 million members, more than 114,000 groups, and located approximately in 170 countries. Alcoholics Anonymous is an effective program for individuals facing alcoholism. Another program is the Al family groups and the Al teens. In similarity to Alcoholics Anonymous, these two groups aim to help relatives and friends of alcoholics as well as teens who may have been affected by someone else's drinking. Registration for these programs are free of charge, and there are no dues or fees for membership. Al-Anon has more than 25,000 groups in over 115 countries and was founded in the year of 1951. Another group named Narcotics Anonymous is a self-help organization that is similar to AA, Alcoholics Anonymous, and helps other type of chemical substance abusers. NA, Narcotics Anonymous, addresses addiction to chemicals including alcohol. NA currently has more than 25,000 chapters and more than 250,000 active members. Treatment programs have also been implemented as an approach to treat individuals with a substance abuse. Types of facilities and treatment include inpatient and outpatient treatment programs at community mental health centers, chemical abuse rehab centers and medical hospitals, halfway houses, and chemical treatment programs such as antabuse. So what can social workers do to help individuals in rural areas who may have a substance abuse? So social workers working with individuals or groups in rural areas should remain aware of community-level barriers to recovery from substance use disorders and work with clients to overcome those barriers. Social workers should also provide their clients with the necessary resources and services that may help them maintain their sobriety. Resources such as inpatient and outpatient treatment programs, 12-step programs, individual rehab counseling, DWI school, and sober houses are all effective in treating individuals with an addiction to drugs or alcohol. Lastly, social workers should also assist their clients in developing a relapse prevention plan so that clients will be able to develop coping skills to overcome adversity and be able to analyze what their triggers may be. Thank you, and this concludes my presentation.